Welcome back, everyone. Today we're doing a deep dive into some really fascinating sources. Our mission is to unpack a new study on mental health, specifically how a maybe surprising therapy is giving lasting relief to cancer patients.
Yeah, it's pretty compelling stuff.
We're looking at new findings on psilocybin, right? Its long-term impact on depression and anxiety for people with cancer. The source is a phase 2 clinical trial, and the results just came out in the journal Cancer.
That's right.
So the big question, I guess, for this dive is, how can just one dose of this, naturally occurring compound offer such significant and long-lasting relief, especially for patients going through so much?
It's a really important question because, look, the mental health burden for cancer patients, it's just huge. I mean, imagine dealing with the cancer diagnosis, the treatment, and then significant depression or anxiety on top of it all.
Yeah.
It's this incredibly heavy load and maybe sometimes overlooked.
Absolutely, a critical point. So this phase 2 trial you mentioned, how was it actually set up to tackle that? Who are the patients? What did they do?
Okay, so this trial, it really zeroed in on a specific group. We're talking 28 patients, and these were people diagnosed with both cancer and major depressive disorder. So not just anyone with cancer, but those really struggling with diagnosed depression.
Right, that specific double burden.
Exactly. And the intervention, well, it was a single 25 milligram dose of psilocybin. And this is really crucial, it wasn't just like, here's a pill. It was given with extensive psychological support. A therapist worked with them before, during the session itself, and afterward.
Ah, okay.
That whole guided experience, that comprehensive support, it's vital to understanding these results, I think.
That support piece really jumps out, doesn't it? We often think of medication as, just the pill. But here, it's clearly part of a bigger picture, a very intentional process. So looking at the long-term data, what was the most maybe surprising or impactful thing they found?
Well, the really remarkable part is how long the release lasted. We're talking about a 2-year period. And this is from just that single dose combined with the therapy support.
2 years. Wow.
Yeah. So when the researchers followed up with clinical interviews after 2 years, get this, 15 patients, that's over half, about 53.6%, showed a really significant drop in their depression symptoms.
Over half, okay.
And maybe even more compelling, 14 patients, so exactly 50%, didn't just improve, they actually achieved remission from their depression.
Remission, that's huge.
It is. And it wasn't just depression. They found psilocybin also helped reduce anxiety in 12 patients. That's nearly 43% over those same 2 years. For patients dealing with severe cancer-related depression, getting to remission from just one guided session, that points to something really profound, not just chipping away at symptoms.
It really makes you think, doesn't it, about the possibilities for mental health care, especially in these really tough medical situations.
Yeah.
So what's next then? Are people building on these findings? Is there more research happening?
Oh, absolutely. This isn't like the final word. It's more of a stepping stone. There's an ongoing randomized double-blind trial happening right now, building directly on this.
Okay, the gold standard.
Exactly. This new trial is looking at up to 2 doses of the 25 milligrams of psilocybin compared against a placebo. And because it's randomized and double-blind, meaning neither the patients nor the researchers know who's getting the real thing, it minimizes bias. It makes the results much more reliable.
Right.
The hope, the aim, is to see if they can get an even larger majority of patients into remission from depression and anxiety. The lead author, Dr. Manish Agrawal, he actually said, if this randomized trial shows similar results, it could really pave the way for, his words, greater use of psilocybin to treat depression in patients with cancer.
That's quite a statement. A potential shift.
Yeah, it points towards a potential new tool in the toolbox.
So wrapping up this deep dive, the core insight seems to be this potential, right, for significant long-term mental health relief for cancer patients. From possibly just one dose of psilocybin, and it's a big, but always combined with that crucial psychological support.
Exactly. That combination is key.
It really challenges the standard way we think about interventions needing to be, daily or weekly for years.
It does. And maybe a final thought for you to consider. What's really striking here is how these findings sort of push against our usual ideas of what effective long-term mental health care can even look like. Especially when someone is facing something as overwhelming as cancer. It kind of forces us to think about totally new ways to provide care, doesn't it? Makes you wonder about how single, maybe profound guided experiences could potentially spark lasting change in ways we haven't fully explored.